Hi, I'm Alyssa Bond, and I chose the topic of the prevalence and prevention of HIV and TB in South Africa and on a global scale. So, just a few background facts before I start. South Africa is reported to have the largest HIV epidemic in the world and the third greatest epidemic of TB. So, with such high numbers, the need for prevention strategies is increasing every day. So, there are 6.1 million people in South Africa living with HIV and over 500,000 cases of people living with TB. 66% of the people that have TB also have HIV. So just to compare these to the US so you understand how high these numbers are, the United States has approximately 1.1 million people with HIV, which is 6 times lower than the amount of cases in South Africa, but the US has 6 times more people in it than South Africa. When comparing TB, it is noted that the USA has almost less than 100,000 people, 10,000 people that have TB, which is 50 times lower than South Africa. So according to the Universal Declaration of Human Rights, Article 25, everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including medical care. So this article declares that each person has the right to the preventative services offered in South Africa, despite their diagnosis and other relevant factors like politics, social factors, and economic factors. So to address these epidemics, the National Strategic Plan was made to decrease the numbers of HIV and TB in South Africa. So there are 4 objectives and 5 goals, some of which are to reduce new infections by at least 50% using a combination of prevention approaches by 2016, as well as to protect the human rights of people living with HIV, primarily through ending the stigma, discrimination, human rights violations, and gender inequality. The NSP, or National Strategic Plan, also targeted 5 populations that are more likely to get HIV and TB, which are women, children from transmission through their mother, men who have sex with men, sex workers, and people who inject drugs. Using these target populations, the prevention strategies have been implemented in order to decrease the numbers of HIV and TB. There is also prevention strategies due on a national scale that target every person in South Africa, like mobile HIV testing trucks, which drive around and will offer HIV testing, TB testing, cancer testing, and high blood pressure testing for free and on the spot. There are also door-to-door consultants that will go around offering these testing kits so you could test yourself in the privacy of your home. These increase the comfort that people have, which will make them more likely to test themselves, which will eventually decrease the amount of HIV and TB cases, and it will also allow people to become more aware and will eventually decrease the stigma of HIV and TB. So according to the NSP, of one of their target groups, there is mother-to-child transmission, and in order to prevent this, they introduced antiretroviral drugs, which are prescribed now in 98% of healthcare facilities. So with this change over a 2-year period, the number of children born with HIV dropped from 56,000 to 29,000. There's also another focus, which is HIV education and awareness. And using this education and awareness, 2 things happen. People understand how to avoid HIV and TB, and they also learn to decrease the stigma, like I mentioned before. Lastly, the NSP focuses on safe sex between couples. So between 2007 and 2010, the amount of condoms distributed increased by 60%. There was also a voluntary male circumcision prevention plan introduced by the South African government because the men who are circumcised are 76% less likely to get HIV. If they're less likely to get HIV, they'll be less likely to transmit HIV, and eventually it'll cause a chain reaction. So it's not only the NSP that focuses on the preventing of HIV and TB, but there's also global organizations. So the Global Fund to Fight AIDS, Tuberculosis, and Malaria attempts to increase the resources throughout all countries to fight these prominent diseases. They focus on the areas that are most in need, but also focus on everybody in the world. So lastly, I chose this topic because I'm an OT major, and this year is my junior year, and they really explain preventative services and how our job is to eventually not create a job for us. So this is why I chose this topic. Thank you.